Becoming a mother is one of the most beautiful journeys of life. From the moment you find out you're expecting, everything changes: your body, your emotions, your dreams for the future. But with all this joy comes an overwhelming responsibility, making sure your baby gets the very best start in life. And here's the truth: one of the simplest yet most powerful ways to do that is through prenatal vitamins. But with so many bottles on the shelves, endless advice online, and conflicting opinions from friends and family, how do you really know which ones matter? That's exactly what we're breaking down today: the best prenatal vitamins every mom-to-be should know about. I'll guide you through the essentials, explain why they matter for your baby's growth and your health, and show you how to avoid wasting money on supplements you don't even need. By the end, you'll feel clear, confident, and empowered to make the best choice for you and your little one. Why prenatal vitamins matter. Let's start with the basics. You might be wondering, if I'm eating healthy, why do I even need prenatal vitamins? The truth is, pregnancy places extra demands on your body. Your baby is growing organs, bones, and even a tiny brain, all from the nutrients you provide. Even with a balanced diet, it's almost impossible to meet every requirement through food alone. For example, nutrients like folic acid and iron are needed in much higher amounts during pregnancy than most women can get from diet alone. Prenatal vitamins fill in those gaps, ensuring both you and your baby are supported. Think of them as an insurance policy for your pregnancy, not a replacement for healthy food, but a reliable safety net. The most essential prenatal vitamins. Now, let's break down the most important nutrients you should look for in a prenatal vitamin. 1. Folic acid or folate. This is the superstar of prenatal nutrition. Folic acid helps prevent serious birth defects of the brain and spinal cord, called neural tube defects. The recommended amount is at least 400 to 600 micrograms daily, ideally starting even before conception. Imagine building a house. Folic acid is like the foundation. Without it, the structure can't stand properly. That's why it's so critical, especially in the very early weeks of pregnancy, often before a woman even knows she's pregnant. 2. Iron. Pregnancy increases your blood volume by almost 50%. That means your body needs extra iron to make more hemoglobin, which carries oxygen to your baby. Without enough iron, you risk anemia, which can leave you tired, weak, and even affect your baby's growth. Most prenatal vitamins contain 27 milligrams of iron, which matches the recommended daily amount. 3. Calcium. Your baby is busy building bones and teeth, and if you don't get enough calcium, your body will start pulling it from your bones. Over time, that can weaken your own bone health. Aim for 1,000 milligrams of calcium daily through a mix of food and supplements. 4. Vitamin D. Think of vitamin D as calcium's best friend. It helps your body absorb calcium effectively. It also supports your baby's immune system and bone development. Most experts recommend 600 IU daily. 5. DHA, an omega-3 fatty acid. DHA is like brain fuel for your baby. It supports brain and eye development, especially during the second and third trimesters. Not all prenatal vitamins include DHA, so you may need a separate supplement or get it from fatty fish like salmon. The recommended intake is about 200 to 300 milligrams per day. 6. Iodine. Often overlooked, iodine plays a huge role in your baby's brain and thyroid development. About 150 micrograms daily is usually recommended during pregnancy. Other helpful nutrients. While the essentials are non-negotiable, there are a few other nutrients that can make a difference. Vitamin B12, especially important for women who follow a vegetarian or vegan diet. It helps with red blood cell formation and brain development. Choline, a nutrient gaining more attention, shown to support memory and brain health in babies. Not all prenatal vitamins have it, so check your label. Magnesium and zinc. These minerals play supporting roles in muscle function, immune health, and overall development. But here's the key: more isn't always better. Too much of certain vitamins, like vitamin A, can actually be harmful in pregnancy. That's why it's crucial to stick to recommended dosages and not overload on unnecessary extras. How to choose the right prenatal vitamin. Okay, so now that we know what nutrients matter, How do you actually pick the right prenatal vitamin from the sea of options out there? Here are a few tips. 1. Check the label. Look for folic acid, iron, calcium, vitamin D, DHA, and iodine as a baseline. 2. Consider your diet. If you don't eat fish, make sure your vitamin includes DHA. If you're a vegetarian, double-check that it has B12. 3. Watch the dosage. More isn't always safer. Stick to recommended amounts unless your doctor advises otherwise. 4. Check form and tolerance. Some women find tablets too large or experience nausea. In that case, gummy or liquid prenatals might be easier, though gummies often lack iron. 5. Talk to your doctor. Every pregnancy is unique. Your healthcare provider can guide you based on your blood work, medical history, and dietary needs. Think of prenatal vitamins as personal. They aren't one size fits all. The best choice is the one that matches your body, your diet, and your baby's needs. Common questions moms ask. When should I start taking prenatal vitamins? Ideally, before you even get pregnant. Neural tube development happens in the very first weeks, often before a woman knows she's expecting. But if you're already pregnant, don't worry, starting now still makes a big difference. Can I just take a regular multivitamin? Not really. Regular multivitamins don't have enough folic acid, iron, or DHA to meet pregnancy needs, and sometimes they contain unsafe amounts of vitamin A. That's why specialized prenatal vitamins exist. Do I need expensive brands? No. A good prenatal doesn't have to break the bank. What matters most is the ingredient list, not the price tag. Generic or pharmacy brands can be just as effective as premium ones. So let's bring it all together. Prenatal vitamins aren't just supplements, they're building blocks of life. Folic acid lays the foundation. Iron fuels growth. Calcium and vitamin D strengthen bones. DHA nourishes the brain. And iodine supports your baby's thyroid and development. Choosing the right prenatal vitamin doesn't have to be complicated. Focus on the essentials, match it to your diet, and always consult your healthcare provider for personalized advice. If this video gave you clarity and confidence, don't keep it to yourself. Share it with another mom-to-be who might be feeling the same overwhelm you once did. And if you'd like more science-backed guidance on pregnancy and child health, hit that subscribe button so you never miss an update. Because when it comes to motherhood, you don't have to walk this journey alone. Together, we can make it a little easier, one step and one prenatal vitamin at a time.